Hi guys, this is Dr. Fatma Qureshi, and today we will be talking about fungal keratitis. In my previous videos, you have probably watched the one that I made on herpetic keratitis, and today we're going to talk about fungal keratitis. And right away, I want to show you what the picture looks like. So this is the white opacified area. This is what a fungal keratitis is going to present as, and this is another very good picture as well. But this is very classic, the whitish area. So fungal keratitis looks a lot different than a typical herpetic keratitis or even a bacterial keratitis because of its presentation as in a white area. It could be filamentous or non-filamentous. Filamentous ones would have the feathery borders, and the organisms that are involved would be Fusarium and Aspergillus species, whereas the non-filamentous is the Candida species. So just remember that. With the filamentous one is going to present with a gray-white infiltrates with feathery borders, and the non-filamentous one is going to present with yellow-white stromal infiltrate that looks very similar to a bacterial ulcer sometimes as well. So without going in too much detail, remember the presentation. So the patient's symptoms could be pain, photophobia, which is light sensitivity, red eye, tearing, discharge, and foreign body sensation. One of the patients that I treated recently was in excruciating pain. So we usually ask them 1 to 10, 10 being the highest level of pain, how much is your pain? And this patient told me his level was level 10, so that was excruciating pain. Now, some of the things to remember as in what are the kind of patients that end up having a fungal keratitis. Remember the word immune compromise. So that would be anyone who has decreased immunity or their immune system is compromised. So that could be in HIV or AIDS positive patients. Also patients who are taking oral or topical steroids. Patients who are on chemotherapy for cancer. So these are the patients who can generally have a fungal keratitis. And also a very important thing to remember is contact lens users. Users who do not take care of the lens hygiene or contact lens hygiene or contact lens solution hygiene, they can end up having a fungal keratitis because of improper sterilization and disinfection of contact lenses, because of use of contaminated lenses, such as overuse of contact lenses. I've always mentioned this thing in my videos. Do not overwear your contact lenses. Excuse me. If your contact lenses are designed for 2 weeks, you use them for 2 weeks and then you throw them away. If they're designed for 1 month, you use it for 1 month. There's a reason why they're monthly versus daily versus 2 weekly lenses. So patients who have contaminated contact lenses or their case is contaminated, meaning the solution that you use, that needs to be thrown away. There's a purpose for having a bottle of solution. You use it and then you throw it away. But if they keep using or reusing the same solution for a prolonged period of time, they can have fungal keratitis. And remember, that's a dangerous one. I remember one case where the patient actually had to go for a corneal transplant. So guys, please remember that. Wearing contact lenses during infections is also extremely a big no. And I've mentioned that in one of my videos where I kept talking about, guys, if you have an infection, please do not wear eye makeup during that time, for women obviously. Or if you have an infection and I'm treating it with the help of antibiotics or steroids, definitely do not put your contact lens back in the eye. And the infected one during the infection time, or the one that you used immediately before the infection, that particular lens or pair should be thrown away. And then patients can get fungal keratitis because of introduction to microorganisms from the environment. So those are some of the things to remember. The most important thing is immune compromised, okay? And then contact lens related fungal keratitis as well. So I described to you the 2 different types, the filamentous versus the non-filamentous. I told you about the symptoms. You can have lid edema also, which is swelling of the lid as in symptoms, but the most important ones would be pain, photophobia, redness, tearing, discharge, and foreign body sensation. Now, the treatment. So the treatment involves the use of topical as well as systemic antifungal medications and cycloplegics. Cycloplegics means that your ciliary muscles that cause accommodation, and they also help with the pupil constriction, they need to be relaxed. Those muscles need to be relaxed. So we can use some drops in order to relax their accommodation and also constriction or pupillary constriction, because every time the pupil constricts, they can have pain. It can increase their level of pain. So we put them on those medications as well. And obviously they will be on topical or systemic antifungal. Steroids, if they're using, they should not be used during this treatment plan. And if the patient is already on steroid treatment, then it should be tapered and eventually discontinued. Sometimes admission to hospitals may be required, and it may take weeks to achieve complete healing. So in one of my cases where the patient was a gardener, he would come with all kinds of different species in his eyes because he was touching his eyes while at work. He used to do gardening, so obviously he was not having the best of eye hygiene. He would touch his eyes. We asked him to wash his hands thoroughly and extensively, but of course he would forget, and because of that he was exposed to a lot of infections, including fungal infections, and it got bad to the point I didn't have to refer him out to a hospital, but I did refer him out to a very good cornea specialist. And I remember that cornea specialist was at least literally 2 hours away from our clinic in a different city actually, and the patient did choose to drive because he said, "Doc, whoever you recommend, whoever you prefer, I'm going to go to that person." And I knew of that cornea specialist personally, and I referred him to that amazing cornea specialist because I knew that his results are going to be, or his treatment results are going to be tremendous. I had referred a few patients before also to the same cornea specialist, and he had shown and proved his expertise in treating really, really complicated corneal infections. Therefore, I referred this patient to that particular cornea specialist, and that was the best thing that I could have done for this patient, because thank God his vision was restored and he was treated fully. So that was perfect. But let's not even wait for these infections to get worse. Definitely come to your doctor, to your eye specialist, an eye doctor, an eye provider, as soon as you feel you're developing any kind of infections in your eyes. So again, one last time, I'm going to show you the picture. This is the corneal fungal keratitis. Okay, remember this. And for this, you have to come to your eye doctor, okay? So if you have any other suggestions for making more videos on different pathologies or different kinds of eye diseases, let me know. You guys have been just amazing audience, patients around the world. Initially, this video started, or this whole series of YouTube channel videos started because in one of my practices, my patients had asked me to make these videos because they felt like they wanted to hear and learn from their own doctor. They would tell me they do not want to go randomly on different sites, on Google or even YouTube for that matter, and get information from different sources which they probably did not trust as much, did not rely on, and didn't have that comfort level also. So they said, "Doc, you need to start your own channel." So that's how it started, literally, and I'm very thankful to my wonderful patients for making that suggestion for me, and since then I have been uploading videos. So continue watching, continue asking questions, and of course the ones that I see in the clinic, you guys can ask me there. But in general, thank you for all the audiences. I look at the analytics and statistics reports, particularly analytical reports that I get on YouTube Studio, and I'm just amazed and really blessed and feel humbled that I have audience from around the world. So thank you guys. And I hope I am listening to your suggestions and answering your questions. I try to do my best because of busy schedule, clinics, work, personal life, family life, and professional life. It does get a little bit difficult, but if you have a passion for something, you take out time for that. I truly believe in that. So thank you everyone, and you enjoy the rest of the day. Take care, bye.